day, listeners, and welcome to DDM Health News Updates. Under the program, your health, your wealth. From Addis Ababa, Ethiopia, Nigerian First Lady Senator Oluremi Tinubu has reiterated her commitment to advancing maternal and infant health alongside women and youth empowerment through strategic advocacy and resource mobilization. Speaking at the 29th General Assembly of the Organization of African First Lady for Development, OAFLAD, Mrs. Tinubu highlighted the Renewed Hope Initiative, RHI, as a driving force in improving healthcare outcomes in Nigeria. She revealed that, through an anonymous donor's generosity, RHI had procured 60,000 professional kits comprising scrubs and crops for midwives, aligning with the federal government's retraining of 120,000 health workers. Mrs. Tinubu began the distribution of these professional kits January 29, 2025, commencing with 10,000 kits in the North Central region during a 3-day visit to Kwara State. The initiative will extend across the country's remaining geopolitical zones in the coming months, reinforcing the government's dedication to reducing maternal and infant mortality. Recognizing Nigeria's status as the country with the highest burden of HIV and AIDS in sub-Saharan Africa, the First Lady launched the Free to Shine Triple Elimination campaign on January 30, 2025. This initiative aims to reduce new HIV infections among women of reproductive age, eliminate a mother-to-child transmission of HIV and AIDS, syphilis and hepatitis, and enhancing reproductive health services. Beyond healthcare, Mrs. Tinubu underscored her plan to collaborate with the Federal Ministry of the Environment to drive environmental awareness in secondary schools and higher institutions through reintroduction of the Environment Climate Change Club. In her address, she aligned with the Assembly's theme, Building to Beijing, First Lady championing women's leadership and rights through African heritage, reflecting on the significant progress women have made since the Beijing Declaration of 1995. However, we acknowledge persistent challenges such as gender-based violence, female genital mutilation, child marriage, and barriers to girl child education, reaffirming her dedication to bridging gender disparities. As a newly appointed steering committee member of OAFLAD, the First Lady pledged to support the implementation of the organization's 2025 to 2030 strategic framework. Africa's true prosperity lies in the strength of its people, its rich heritage, and the pivotal role women and youth play in shaping our collective future, Mrs. Tinubu stated, calling for collective action across nations. The Assembly saw participation from 13 First Ladies, with additional representations alongside key speakers including Manita Sesomwa, outgoing AU Commissioner for Health, Humanitarian Affairs and Social Development, Prof. Sinit Fisher, Vice President, Global Programs at the Susan Thompson Profit Foundation, and Winnie Bayima, Executive Director of UNAIDS. The session included with a strong call to bridge Africa's 16 billion funding for women development and children welfare. In a concerning development, the Edo State government has confirmed the loss of 13 lives due to Lassa fever outbreak, with 83 confirmed cases reported since December 30, 2024. The Director of Public Health at the State Ministry of Health, Dr. Stephen Ojifo, provided this update during a press briefing in Benin City. Dr. Ojifo disclosed that the state had recorded a total of 378 suspected cases, with Esan West and Esan Northeast local government areas identified as the epicenter of the outbreak. 7 patients are currently receiving treatment, while several others have been discharged following recovery. The high mortality rate, he noted, is largely due to delayed presentation at health facilities. To curb this trend, the Edo State government is intensifying efforts in collaboration with private hospitals to ensure timely referrals to the Iro Specialist Teaching Hospitals, the state's designated center for Lassa fever management. Additionally, health officials, in conjunction with the Nigerian Center for Disease Control, have been actively conducting contact tracing in affected communities. Dr. Jifo emphasized the importance of early detection, noting that Lassa fever often mimics malaria in its early stages before progressing to more severe symptoms. He urged residents to seek medical attention immediately if a fever persists beyond 72 hours and to avoid self-medication. In a related development, the state has also recorded 3 cases of mpox, commonly known as monkeypox. However, no fatalities have been reported in these cases. As the government ramps up public health interventions, residents are advised to remain vigilant, adopt preventive measures, and report any suspected cases to the nearest healthcare facility. Now, in a significant revelation, the National Coordinator of the National Cancer Control Program at the Federal Ministry of Health and Social Welfare, Dr. Uchechukwu Nwoku, has disclosed the children account for 7.2% of the estimated 127,000 cancer cases recorded annually in Nigeria. This statistic shared during a public enlightenment event in Abuja to mark the 2025 International Childhood Cancer Day underscores the urgent need for targeted intervention in pediatric oncology. Dr. Nwoku highlighted that while cancer remains a major health burden, early diagnosis and timely access to treatment significantly improve survival rates among children, reaching as high as 80%. He noted that leukemia is the most prevalent form of childhood cancer, distinguishing it from adult-onset cancer. Encouragingly, children often exhibit a greater resilience to treatment due to their robust physiological response, enhancing their ability to tolerate chemotherapy and recover more efficiently. Additionally, advanced medical interventions such as stem cell transplants further improve survival outcomes when accessible. Recognizing the historical gap in healthcare support for pediatric oncology, the federal government is taking decisive steps to integrate childhood cancer treatment into the Cancer Health Fund. This policy shift, expected to take effect in 2025, aims to provide financial relief to affected families and improve access to life-saving treatments. Globally, childhood cancer remains a leading cause of mortality among young populations. According to the World Health Organization, approximately 400,000 new cases are diagnosed each year, while survival rates in high-income countries have seen remarkable improvements. The situation remains dire in many low and middle-income nations due to inadequate diagnostic and treatment facilities. With a renewed focus on childhood cancer in Nigeria, stakeholders are hopeful that improved funding, enhanced awareness, and strengthened healthcare system will drive better outcomes for young patients battling this disease. As we commemorate International Childhood Cancer Day, let us join hands in advocating for better healthcare policies, early detection, and increased access to treatment for our children, because every child deserves a fighting chance. Next, in a strategic move to fortify Nigeria's health security architecture, the federal government has engaged the World Bank for a fresh $300 million loan aimed at enhancing the national capacity to prevent, dictate, and respond to health emergencies. According to information obtained from the World Bank, the Nigerian Center for Disease Control (NCDC) will oversee the implementation of the project, while the Federal Ministry of Finance will act as the borrower on behalf of the government. The proposed Nigerian Health Security Program is designed to expand molecular laboratory capacity, upgrade primary healthcare centers, establish emergency operations centers, and construct medical warehouses across the 36 states and the Federal Capital Territory. The initiative will also deploy mobile laboratories, install water, sanitation and hygiene facilities, and integrate solar energy solutions to enhance health infrastructure. As part of broader government efforts to strengthen public health resilience, the program aligns with the World Bank's ongoing investments in health, nutrition, and population sectors across Western and Central Africa. The project is currently in its pipeline stage, with a disclosure date set for February 6, 2025. The World Bank Board is expected to make its final decision on July 30, 2025, following the appraisal schedule for April 14, 2025. Implementation is slated to commence in the 2026 fiscal year. This funding commitment is part of Nigeria's long-term strategy to reinforce its pandemic preparedness and emergency response mechanisms, particularly in the wake of lessons learned from previous outbreaks including COVID-19. However, the initiative also carries significant environmental and social risks associated with infrastructure expansion. Speaking on Nigeria's economy's trajectory during a meeting with the World Bank Executive Director Dr. Zainab Shamsuna Ahmed, Minister of Finance and Coordinating Minister for the Economy, Wale Edun, underscored the government's commitment to reducing dependency on external borrowing. He reiterated President Bola Tinubu's vision for private sector-driven economy, emphasizing the administration's dedication to fostering a business environment that attacks sustainable investments. While acknowledging the World Bank's critical role in Nigeria's development, Edun reaffirmed the government's focus on strengthening economic foundation to ensure long-term financial sustainability. As Nigeria positions itself for greater economic resilience, this latest investment underscores a pivotal shift towards a proactive, well-equipped health system capability of addressing public health challenges and safeguarding national well-being. Now, let's move to the United States. In a dramatic turn of events, the United States' decision to suspend overseas funding has sparked urgent warnings from global health leaders, with millions of lives now hanging in the balance. The move, ordered by President Donald Trump upon his return to office in January, has left humanitarian organizations scrambling to mitigate the potential fallout. The United States Agency of International Development, UAID, has long been the world's leading provider of official development assistance. However, Trump's directive placed a 3-month freeze on foreign aid, including a temporary suspension of the president's emergency plan for AIDS relief, a program that has been instrumental in providing life-saving treatments and support to over 20 million HIV patients worldwide. Although subsequent exemptions were made for essential medications, the head of UAID, Winnie Bayima, warns that the impact remains catastrophic. Speaking at the African Union Summit in Addis Ababa, she sounded the alarm on the far-reaching consequences, stating, "If this funding disappears, people will die." The numbers paint a grim picture. According to USAID estimates, the suspension of US funding could lead to a tenfold increase in AIDS-related deaths, with 6.3 million additional fatalities projected over the next 5 years. New HIV infections could also skyrocket, reaching a staggering of 8.7 million the same period. While the US government has assured that life-saving treatments will remain exempt from the funding freeze, reports from frontline health workers in Africa reveal that facilities have already begun shutting down, jeopardizing access to critical services. In light of the crisis, Bayman has urged African leaders to reduce their reliance on foreign aid and shift towards domestic revenue mobilization. However, with many countries grappling with gripping debt, some owing more than 50% of their total revenue collection, the ability to refill the funding gap is a daunting challenge. She emphasized the urgent need for immediate and comprehensive debt restructuring, stating that overwhelming debt burdens are crowding out essential investments in health and education. For decades, USAID has played a crucial role in global health, development, and humanitarian efforts, with an annual budget exceeding $40 billion. The suspension of its overseas program represents an unprecedented disruption that could reshape the global fight against HIV and AIDS and other infectious diseases. As the world watches, the question remains, will global leaders step in to prevent a public health catastrophe, or will millions be left to face the consequences of a funding shutdown? This is a developing story, and we will continue to monitor the situation as it unfolds. Stay tuned for further updates. Don't forget to like, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, for more updates. Until next time, I am Nyenye Michael Inezinde. Bye for now.